Hi, everyone. This is Ingrid Kitty Trim. I am the founder and executive director of Part Texas and Part USA. I'm coming today on with an update that happened today with the Texas Medical Board meeting. First out, I have to give a shout out to Dr. Mark Ibsen. If it wasn't for him notifying me and Part Texas of this very important meeting that happened today, this wouldn't have happened. So this is what collaboration looks like. This is what partnership looks like, informing each other, giving us information, and helping out. And Mark Ibsen is a true champion of chronic pain patients, and we are so grateful for the information that he provided because I this is going to be an extremely great update. First, I also want to say thank you to the American Pain and Disability Foundation, and again to Dr. Mark Ibsen, and to Bob, and to everyone who's helped get the word out quickly, and to every patient and advocate who has paid attention to this. It's been very important. This came together very fast. We were notified late a couple days ago that we had a very little time to organize. But even with the short notice, Texas patients and advocates showed up. Today, during the Texas Medical Board meeting, we had multiple people connected to Part Texas attend and speak during the public comments. Deborah Oliver, who has been a longtime supporter of Part Texas, spoke, and also a Jolene, a newcomer and supporter, and a former nurse with significant medical experience, also spoke. Both of them mentioned Part Texas. I also spoke as the founder and executive director for Part Texas. I gave a brief statement, but most importantly, I read a statement from Melissa McVeigh, who is our vice president and board member. Melissa is a registered nurse with a master's degree and more than 20 years of experience in healthcare. She was not able to, unfortunately, attend herself today due to a work obligation, but she gave me permission to speak on her behalf and read her statement. And I read it exactly as she had written it out. And I want to be very clear. It went extremely well, better than I had ever hoped. The Texas Medical Board listened. They asked questions. They asked how many members Part Texas had. I did not have the exact number in front of me, so I gave an approximate number around 50. That question really matters. It shows that membership numbers matter. It shows when an organization speaks, people want to know how many people are standing behind it. That is why even free membership matters so much. Paid memberships help, of course, and it helps keeping us building and be able to do things that are necessary, like the Washington, D.C. trip with the American Pain and Disability Foundation. When an organization speaks, people want to know who's standing behind it. So, we are a growing organization's voice for pain patients, and we absolutely need that. Every single member that actually signs up shows that we are not just one person speaking. We are a organization in Texas willing to speak out. And Part USA was built for the National Foundation in order to do that on a national level. But this is why states are so important also to work on both levels. The most encouraging part is that the Texas Medical Board today indicated they are going to have a representative reach out so we can discuss and begin how Part Texas may be able to work with them regarding chronic pain patients and intractable pain patient concerns. That was a huge deal. This does not mean everything is fixed. It does not mean the fight is over, but it does mean a door opened today. This message we brought forward was simple. Texas patients documented chronic pain and tropical pain are being abandoned, tapered, refused care, or left unable to find doctors willing to treat them. Many doctors are afraid. They are afraid of regulatory scrutiny, pharmacies, insurance companies, and federal agencies, and the continued misuse of the CDC opioid guidelines as if they were law. Patients are not asking for reckless prescribing. They're asking for the individualized medical care based on diagnosis, records, function, history, and physician's judgment. Today, that message was placed directly in front of the Texas Medical Board. This is why organized advocacy matters. When patients speak alone, they can be dismissed as one story. When patients speak together, supported by an organization, supported by nurses, advocates, experienced voices, and doctors, it becomes much harder to ignore. I also want to say this for people outside of Texas. What happened today in Texas can be an example. For every state needs organized patients. Every state needs people showing up at medical boards, legislative offices, public meetings, and hearings. These decisions are being made whether we are in the room or not. We have to be there in the room. Once the Texas Medical Board uploads the meeting video to their YouTube channel, I plan to pull the relevant portion and share it. That clip will be important because it will show why this kind of work matters. So tonight, I want to just say thank you. Thank you to the patients who showed up. Thank you to the advocates who helped support and spread the word. Thank you to Melissa, a vice president of P.A.R.T. Texas, for writing such a strong statement and allowing me to read it. Thank you to Deborah and Jolene for showing up last minute and speaking on behalf of P.A.R.T. Texas and in their own experiences. Thank you to American Pain and Disability Foundation for amplifying this message and this organization. And thank you to everyone who believes chronic and intractable pain, acute pain, deserves dignity, compassion, and appropriate medical care. Today was a huge win. Not the final win, but a real one. Now, we will build on it. And we have some exciting news, more than likely coming at the end of this weekend, concerning the Texas GOP and the state convention there. Things are booming down there as well. I want to acknowledge the people who have gotten us here. We have experience that others don't, and others have built the organization and gathered people and helped pain patients out there. One of the reasons why I'm joined with American Pain and Disability Foundation. They really care about the people they help, as do we. And this is just a wonderful partnership to have. This was just so exciting me today. I had to share it. I want to give people encouragement that things are happening, and they're happening fast. Faster than I ever expected them to do so. So, if you haven't joined our membership, then again, it can be free. My goal is numbers. If you're able to support us, please do. This helps us with trips to be able to get down and be in person. Thankfully, today's Texas Medical Board meeting was held also virtually, not just in person in Austin, Texas. So we were able to do it there. And we will take those ways when able to. But if we're able to show up in person to a face-to-face meeting, that means the world and sometimes can make a huge difference. Unfortunately, that just takes money. But regardless, I didn't want to take away from this win. And again, I cannot thank Dr. Mark Ibsen so much for sending me an email and a message letting me know about this. Even though it was last minute, we scrambled. So once again, thank you, Dr. Mark. You are a true champion of chronic pain patients. And thank you, Bob. God love that man. He is so good to people. He works so hard and really deserves a lot of credit. Even though I know at times he doesn't take it, he really does deserve a lot of credit. Anyway, I'm going to let y'all go, but this is a huge win, and we will be in touch. If you have any questions, please feel free to reach out at info@partexas.com, visiting our website at partexas.com, or you can email me personally at mrslady.kitty@partexas.com. Thank you so much, and you all have a blessed rest of your day.